How's everyone doing? Is myself, Jeff Black. I Brandon DeCruz, and probably maybe my best friend, one of my best friends, close buddy, pal, comrade, Jason Theobald, Scooby. He's with us today. We have episode 57, PCOS, how to manage PCOS through functional nutrition, supplementation, and lifestyle changes. So Brandon and I are going to take a very atypical turn on this to what you've normally been asked and where we normally go.
Okay.
Because it's a different setup is how Brandon wanted to approach that. But we're going to get into how our last 7 days have been.
Sure.
I'm going to kick this baby off. Mine's been good. I've been working on my cover for my book. I've been going back and forth with this amazing book cover artist. My editor literally has made me feel so good that I almost am scared of the book getting out there now, because she's like, I'm so drawn in. It's such a good book. And she's like, I'm like, oh shit. Okay. And then
roll with it, man. That's fucking good.
I know. And then Steven wrote me a blurb. So that will go on the front of the book. And that's all I'm going to have. I'm not going to do a forward. I'm not going to do anything of that. Just Steven's blurb, my cover, and get to fucking work with it. I started working on book number 2. Just to give myself some free time, because I just had been bored and was like, well, I enjoy writing. And I think a lot of that is because, today I opened up Instagram and I legitimately can't stand people copying and plagiarizing people without giving credit. And when I see a complete idea, example, you should read a book and listen to a book at the same time. Hormozy said that. Alex Hormozy said that. And when I see other people saying that and they're not giving credit, I'm like,
I actually saw that recent post.
Yeah, I'm like, what the fuck? But you see this in the fitness industry, because you guys see my bookcase, it's littered with shit in the back. I'll read these functional books and I'm just like, man, that looks pretty beyond the pill to me. In fact, that looks like page 57 to be exact. Bullet points, come on, man. This industry, if you guys want to be good, write it out like they wrote it, and then write it again, and you'll change your words, and then write it a third time. And then guess what you're going to do? You're going to fucking learn it. And then you don't have to be a wannabe and pretend. But this space, man, it's still got a long way to go to clean up if we're going to keep plagiarizing your shit. And I just think that sucks. I have never, ever not taken away from the fact that I have learned so much shit from Jason. I will always be like, oh, I learned this. Him and I in the last few months been going back and forth about autophagy and keto and different shit like that. You and I talk about different stuff all the time. That's the people you want to surround yourself with, not those who just copy shit word for word. So I'm going to step off my 100% thing. But as a writer, man, I think maybe it just chaps my ass more because I have the discipline to sit there and write down. You don't have the discipline to think about that. You just literally word for word that shit.
Yeah.
Anyway, so Jay, I'm going to skip over to let B finish this out, because I'm going to let B intro this out today. How's your last 7 days been? I just saw you a few days ago. We did an episode with John Gorman over supplements and all that. So what's been up with you?
Get a lot of first world problems, putting the heater in my pool. And of course,
poor baby.
One of the pieces didn't come that lets me control it from my phone. So now I got and I got to push the button to I'm first world problems. And then the damn HVAC, I have 3 of them. One of them went out in the living room. So I got a guy coming today. My guy who does the landscaping has a hernia. So now that's not getting done. So I got another guy coming today to get me. It's
can you tell the guy with a hernia he's a pussy? Be like, my friend's got a broken back and he shows up to work every day and still works out.
Get out the riding lawnmower, man.
Yeah, get out the riding lawnmower. No shit.
He does that. He's got my grass covered. I need all the shrubbery recut and planted, and I want new mulch and all that shit. So anyways, I got a guy coming, but yeah, first world problems. As far as business is going, it's excellent. I signed 3 people on the weight loss resistance package of mine, and it's just been a really good week in terms of that. I really have no complaints on the business side of things. Kind of trying to just enjoy myself. I'm going to Charleston next week. I've been doing a lot of traveling, and really this year, I've told people, it's about business, and I'm going to travel some, and and then I'm going to work on myself some. I'm going to work on myself some. That's for sure too. Maybe even a little counseling, stuff like that. But yeah, that's kind of where I'm at, man. It's a pretty good spot to be in, I guess. So, happy to be here today. So yeah, that's about it, I guess.
2 things. Find a counselor who works with CEOs, because that was the biggest game changer that I found with mine. Someone who kind of understood the whole, I'm afraid I'm going to lose it every fucking day. Yep. Yet I still need support getting through it. You know what I mean? When everybody else emotionally dumps on me with their shit and I still have to figure out how to do my shit. And the second thing is Charleston won't be as fun without me. Remember 2018, how high we were and just roaming around Charleston the whole time. Dude, that's where Jason and I bonded probably on that trip. We could stay together for like 3-4 days straight, just high, roaming around. My ex was competing and we had a great time. So
we really did.
Yeah, I hope you have a good time there, dude.
You remember the dinner where we parked and that guy's car like kept running for like 15 minutes and we're all just listening to his car just like go brr. Like he turned it off, Brandon, and his car just keeps running. And Jeff and I are like high as hell. And we're like, is this ever going to turn off? And the dude was so embarrassed as he's like walking away from it because he knows it does it every time. And we're just outside like having a nice conversation. We're just listening to dude's car. We're like, when's it going to turn off? Like, do you remember that, Jeff? It took forever. We're laughing our asses off. Everyone's just like, what the fuck?
I remember that. And then you and I going over the bridges and me being like, I wonder how often these bridges are checked.
Yeah.
Like, and then like we'd fall into the ocean with the great white sharks and be eaten. Yeah. And I had a hypothetical conversation about that. But B, how's your last 7 days been, bro?
Man, my last week has been great. On the business front, I've signed a couple new clients and I've been doing a lot of consultations. Obviously, you guys know summer's quickly, approaching and around the corner. So now people, even if it's a little bit last minute, they're trying to get in shape. So I'm obviously here to, help them get to their goals and get themselves back into shape in multiple capacities. But another big thing, I know, Jeff, we were speaking about this off air last week. I was in torrential downpours last week and it was flooding down by me because I'm right by the water. Luckily, the Northeast is finally warming up. So I've been able to one of the activities I like most, especially for like parasympathetic nervous system activation, is after my work day is done in the evenings, I'll drive out to the beach. I'm only a few miles away from the beach. I just like, going out there, decompressing after a long work day. And I've been doing that. And that's just me being able to get my own time. My phone, I had no reception. There's no email. There's no text messages. So that's something that I've been able to take advantage of, especially because it hasn't been flooding. It hasn't been flooded out here. So I've been able to go on a walk on the beach and really enjoy it. But before we get into today's show, and I provide an intro to the topic, I want to say that
can I say something real quick?
Yeah, absolutely.
So you know how I'm dying to get you to move to Tennessee?
I know.
Our great governor just decided to allow us to have sales tax free all the way from like July through November. Everything is sales tax free at the grocery store. But it's for the grocery store. Nope, for this year. But he's giving us relief during high inflation times, man. That's a government that works for the people. You gotta love it.
Comparatively to Jersey, where I'm getting raped left and right, almost like Jeff Sue out in Boston. I might have to consider that, my friend, a little summertime rendezvous.
Mm-hmm. Absolutely. Anyway, well, go ahead, man.
All right. So before we get into today's topic, big thing when we rarely bring on guests onto the show. It's generally just Jeff and myself. But one of the reasons, that I'm really excited for today is, Jason, you are one of my mentors. You are someone that I have an immense amount of respect for. And kind of like Jeff was alluding to, a lot of times we do have in this industry where we have essentially imposters. We have people that kind of just regurgitate information. And a lot of times they're not alluding to or giving credit to those who, we stand on the shoulders of giants, essentially, and we learn from other people. And Jason, you're someone that I've shared this many times on air, on your podcast, in seminars, that I have learned immensely from you. I mean, even back to the boards, like we're going 2012, 2013. And I got to give you credit, man. You are one of the people, you as well as John Meadows, you were the two people I consulted because in terms of coaching, because at that time, I worked in a corporate supplement industry for a long period of time. And it was between you and John Meadows that gave me that advice. Wait until, keep that steady, secure job until you surpass your corporate income and then take the leap. And last year, luckily, right after the PEC 5 or 6, the one that was in June last year, I took the dive and went full time. So, I owe you a lot of credit first and foremost. But really, today, what we wanted to do was cover the topic of PCOS. I know this is something I've learned a ton from you about. I've taken your mentorship course, and I've obviously taken other courses that you deliver just on a one-off video course type of format. But really, when it comes down to it, most of the cases I have come to me, and I'm sure you guys both can attest to this and say the same. Most of the times that I have a case come to me with hormone or reproductive issues, they're from female clients, not male clients. And this isn't to say that male clients don't deal with hormone issues. It's just not as common because of how stress affects females' endocrine function as compared to males. So on today's podcast, we wanted to bring you on specifically to cover the female-specific topic of PCOS, which all three of us have encountered with clients in our coaching practices. And PCOS is a complex syndrome that has reproductive, metabolic, and psychological components and implications, and affects between, if we look in statistics, right now we're looking at between 6 to 21% of women of reproductive age, and it's one of the leading causes of infertility in females. And we see that the prevalence of PCOS is higher in those who are overweight or obese and or insulin resistant. However, this is something we're going to cover this, when we go through the types, but this is something that a lot of people don't realize can affect lean, active, and insulin sensitive individuals. It's just not as commonly seen or diagnosed. And the reason PCOS is complex is because it's not just one specific syndrome. It can come in multiple forms or types with varying causes, criteria, and symptoms. So PCOS is a syndrome predominantly driven by someone's lifestyle, which is where we as coaches can help a client improve their nutrition, their training, their stress management, and their lifestyle as a whole to mitigate the symptoms of this syndrome. So on today's show, we're going to dive in deep with Jason about what PCOS is, how it's diagnosed, the signs, symptoms, and issues caused by it, the types of PCOS that we encounter in clients, and then some of the interventions that we use to manage its effects. So, just to start off the conversation, Jason, could you give us an overview of what PCOS is and how it's diagnosed?
Yeah. So you have polycystic ovarian syndrome. And so when you hear the word cyst, you're probably thinking, well, there has to be cysts. You can have PCOS without cysts. You can have PCOS with cysts. I think they've even discussed renaming it, and it probably would be a much better way to go about it. But so what we see with PCOS is you're going to see hyperandrogenism first and foremost. So what that means is one of the androgens is going to be elevated on labs, whether that's testosterone, free testosterone, DHEA, and then you could have the androsterones, androstenediones, and you're going to really look at a Dutch to go deeper on that.
I was going to ask that. Do you do Dutch and blood work, or do you recommend
you can
one
get
of
those
the
on
other?
blood?
Okay.
You can get those on blood, but then the panel, it gets more expensive, and I don't get those immediately. But if someone's still having like hirsutism, oily hair, shedding hair, acne, and you're not seeing it, but it's basically they got the low progesterone, they've got, some factor pushing it, which we'll talk about, then maybe, I get those blood markers, and you could do the androstenediones and everything on blood. But at that point, a lot of times I go Dutch and I want to see all the like downstream pathways and what's going on. So you're going to have hyperandrogenism. And like I said, that doesn't just have to be testosterone. Get that through your head. It could be DHE and the androsterones and androstenediones and things like that. And then there's going to be a driver to the PCOS. And there's four main types. There is, like Brandon alluded to, the insulin resistance type. And so we can talk about how we find that on labs and what we're looking at. And then there's going to be the inflammatory type. And then there's going to be post-birth control type, which can drive it. And then we'll have the adrenal PCOS, so we're talking about stress. And as Brandon said, this is a lifestyle disease. So you are genetically coded for it, but your environment and your choices pull the trigger. This can be managed very easily and very well with the proper tools, which I'm sure we'll go into today. But that's in a nutshell kind of what you're looking at. The hyperandrogenism with some sort of driver. And those four main ones are the ones that, we see pushing the ovaries to basically overproduce an androgen.
So then real quick, do you think I'm nuts for telling parents like to start having the hormones tested for girls using Dutch at 16 years old? Some of those girls, I'm like, hey, have it done once a year and you can start watching how that thing goes. It's no different than the weight loss comprehensive panel we recommend. And stuff
why I like that even more is because you can find out if someone is biasing their estrogen metabolism down 4-OH.
Yep.
And a simple DIM would put them way more into 2-OH and could save them down the line, uterine, ovarian, breast cancer, especially if it's in their family. If I had a daughter and there was any inkling of those type of estrogen driven cancers, 100%. And even then, just because it's not in the family, maybe, they got it. And so, yeah, I think it's a great idea. And to be honest with you, if medicine was more preventative, I think every woman, female, once they become of age, reproductive age, should probably have a Dutch, and you could save some lives there.
I agree with that. I told my older sister, we were talking about that. I said, hey, get this stuff done for the girls. Ava's 18. And I was like, that way she can start having this done yearly. and know, and that way it helps her understand fertility. It'd be help her educate herself on her hormones and things like that. So yeah, I was just curious because I Keegan, man, I do a comprehensive weight loss panel on him every year starting last year, and he was 11.
Yep.
So that way you just start seeing it. So I just, sorry to inject, but you said that made me
No.
go, I think that, as a coach, your due diligence, if you know they have girls, to maybe start talking to them as well. Like, hey, you have these issues. Odds are your daughter probably might want to start looking at this now and get ahead of it.
And then, aside from the estrogen metabolism, I know we're down a little bit of rabbit hole here, but that's okay. Women, young girls, females in high school sports, they're overtrained, in my opinion. It's like, get to the gym in the morning, and then we're gonna have, practice all week, 5 nights a week, and then play all weekend. And a lot of them aren't eating properly. And so they're already having problems with, the reproductive system and low progesterone and not having their period. So it's starting very early to set them up for extreme hormonal issues and downregulation of the metabolism years down the line. So, I think, I don't know when that's going to change, if it's ever going to change, but at least if you got that, you can see if their progesterone's tanked, are they running estrogen dominance, all those things. And of course, the parents listen out there that don't know how to read these things, but there's like, my clinic would read them. I read them. I'm sure you guys offer the same service. So there's plenty of people out there that can read these for you and get you the information you need.
100%. No, Jeff, I'm actually glad that you went down that path, because even though it was all encompassing, when we actually look at PCOS, it's often misdiagnosed or it's overlooked because people aren't testing correctly. So when we actually look at like the Rotterdam criteria, a female is diagnosed only if she has 2 out of the 3 criteria. So like Jason hit on, hyperandrogenism, so high, elevated levels of androgens. There's menstrual cycle dysfunction as well. So we could see oligoamenorrhea or, full amenorrhea, where, they either have elongated cycles or they have a full cessation of their menstrual cycle. And here's the thing, I'm sure you guys have seen this as well. I have certain females, if they're misdiagnosed, sometimes they have hypothalamic amenorrhea, so the loss of the menstrual cycle or menstrual cycle function as a result of low energy availability, over dieting, doing excessive amounts of training volume. And then they're told that they have PCOS, but they have none of the other complications.
I see it all the time.
Absolutely. And then also the third component of that Rotterdam criteria is polycystic ovaries. So multiple, ovaries, however, or multiple cysts on ovaries. However, like Jason alluded to, you don't have to have that. So it's not like you have to get, an ultrasound and see that for you to be, considered or diagnosed with PCOS. So now let's expand more on the types of PCOS. Or actually, you know what, before we go into that, let's go over the signs, symptoms, and issues caused by PCOS, because that'll give us more of an all-inclusive, look at what are these females suffering with and what should they look out for, because part of this is a lack of education on the topic, and then also a lack of monitoring by the allopathic medicine system.
Yeah. So like you just said, there's going to be usually reproductive issues going on. Whether they're trying to have a baby or not, there's going to be some issue usually with the period. And I find that, usually progesterone is low in these cases. And then, they're going to have hereditism. That's, it's a possibility they have hereditism. Hair's growing oddly in the chin, the face, the belly. I hear that one a lot. Just odd places that are not meant to in a female.
What's interesting about that, but we also see hirsutism, which is the excessive body hair growth. But then also sometimes we'll see, from the high amounts of DHT conversion, we'll see male pattern baldness. So they'll have a thinning hairline, but then they'll have more body hair. So it's, sometimes 100%. They're only looking for one, sign and symptom, but they have another, and it's indicative of a potential of having this. But
hair shedding was going to be my next one. Or oily hair, oily skin. Acne that you really can't explain can be driven by that DHT and, the hyperandrogenism. And so, and then when you think of some drivers, then some women are going to be inflamed, they're going to be puffy, they're going to be watery. Same again, if you got insulin sensitivity issues, they're going to be puffy, watery. There might be high stress, so not sleeping well. And obviously that could be a million things, but when that progesterone falls, you're going to have more anxiety. You're going to be not sleeping well. So I see that coupled with the other more prevalent criteria that I just listed. So, if you're suffering from a lot of those things, it's definitely something that you should check out and have someone that knows what they're doing and looking at labs properly. Because like Brandon said, I've seen it so many times where it's just hypothalamic amenorrhea and it has nothing to do with PCOS. But it's called that because they have a cessation of their menstrual cycle. And so, that's a PCOS.
Or it's covered up with birth control. You know what I mean? We have, and we'll
100%.
discuss post birth control PCOS, but a lot of times I'll even see certain females that they've been on, birth control since they reach reproductive age. And
Yep.
so they've masked this symptomatology. They don't see obviously they're taking, exogenous hormones. So it's suppressing these levels. So they're not even seeing these things come up on blood work. They don't know if they have a normally menstruating, a normal menstrual cycle because it's being suppressed exogenously.
Correct.
And so they don't even have the implications or some of the symptoms that could really, allude to the fact that, yes, I have PCOS and I need to get this, taken care of.
100%. I agree. So, I mean, those are the main symptoms that I see women come to me time and time again. And then the brain, my red flags go off and it's like, okay, we got to start looking at all these different.
Absolutely.
Criteria.
It's all with coaching. It's always about pattern recognition. We've
Correct.
seen a lot of these things and we're just tying things together essentially. And that's sometimes what the conventional medicine model overlooks because they're not really diving in deep. The average, clinician has 8 to 15 minutes, if that, with each client where we're working, countless hours with each client that we work with. So then just to, branch off a little bit, Jay, what are the 4 main types of PCOS and what are the causes of each type? And really, let's start with the insulin resistant driven PCOS. Because that's generally the most common type. That's the most common type that I see. And also when we look statistically and we look in research, we find that between 64 to 70% of patients with PCOS have insulin resistance. So it's a really common pathology that accompanies PCOS. Then also, I know you'll explain this, but it also contributes to the severity of PCOS. So let's start with that one.
Yeah. So the insulin resistance one is going to be the most prevalent, and that is the one where you're going to see more overweight clients, poor diet, poor sleep, basically a poor lifestyle with obviously the genetics that are coding for this. And so what does insulin resistance mean? It means the cells aren't responding to insulin. And so what is going on is the insulin then has to rise because it needs more to shove that glycogen into the cell and cause that GLUT4 to come to the cell and push that in. And so you're going to see high fasted insulin. So it's very important that you get that on your labs. I get that on every one of my metabolic panels. But if you're talking these symptoms that we just laid out, you better be getting fasted insulin as one of your markers. Now, I also get A1C and I also get glucose. But at the end of the day, you can have a good glucose number with a really shitty fasted insulin because 30 I use, 30 on the insulin is horrible, but it's doing its job and keeping that glucose for now at a good level. So that fasted insulin is going to be high. And then in the people that are genetically coded for this, it pushes the ovaries to push out androgens. And so when that insulin is sky high, that's why we see the ovaries then pushing out these androgens and the symptoms are just, horrible. Now, what also is going on with poor diet, you're also pushing inflammation. And so you've got an inflammation on top of that, and usually poor sleep. So it's the insulin resistant one. You really got to go in and think about some weight loss, improving sleep, getting progesterone where it's at, and getting the diet right for improving that insulin resistance. So, there's a multi-discipline way to do it, and there's supplements, and I think we're going to cover that too. But that's just kind of the thought process that you have to have when you're dealing with the insulin resistant type.
Absolutely. It's a multifactorial issue, and we have to take a multimodal approach to it for sure. So besides, obviously a lot of these, they overlap with one another, but if we're going from insulin resistant, probably the one that's most closely tied to that is inflammation or inflammatory PCOS, which we can cover next.
Yeah. So, one of the markers that you can look at is CRP. That can be showing inflammation. And so I'll look at that and see where we're at on that. But, I've seen, the high androgenism, and CRP isn't over 3. But you can see how puffy they are. And, maybe the adrenals are fine. Cortisol's not fine. Insulin's fine. And so I treat it like an inflammatory case. There's a lot of inflammatory markers that you could push to get them to get. CRP is the most common. Brandon, you might have a few maybe that you look at as well, but I
do LDH. I always look at as well. I know that's one that you've alluded to as well. And then also sometimes even like ferritin and things of that sort.
Not the name
being a big marker for inflammation.
Correct. So, you can get some of those as well if the CRP looks okay. But a lot of times with the inflammatory one, I kind of rule out the insulin issue and I rule out the adrenals. And if they have that hyperandrogenism and all the symptoms and they're puffy as hell, I go in hard as an inflammatory PCOS and go that route.
Awesome. Yeah. So let's go on to adrenal PCOS, because this is, we could categorize this kind of like, people have heard this term lean PCOS, and this is
Mhm.
the one we commonly see in athletes, especially
Right.
competitors that we work with. So a lot of our audience are former athletes, or they're even lifestyle competitor or lifestyle clients that really push themselves. So they're trying to become, get really lean for summer or get photo shoot ready. And this is the category that these females would be most susceptible to falling into.
Yeah. So, with this one, it's obviously a stress component. And what you might see is high cortisol. For me, I like 10 to 15. So you might see a 17, 18, 19, 20, 21, something like that. You also might just see high DHEAS. And so, that again is an androgen, but it's also created from the adrenals. So if you have that, and then you
Because it's
have,
the sulfate version, right?
what's that?
Because it's the sulfate version from the adrenals,
Yes.
right?
Well,
Okay.
yes, yeah.
Yeah.
And so it's produced by adrenal glands. So they're overworking. And when this happens, it can also signal the ovaries to overproduce androgens. And so in this type of PCOS, I always really check for cortisol. I check DHES. And if we've got those issues, plus look at your symptoms, are they sleeping well? Are they pushing for a show? Did they just do a diet? Have they been a chronic undereater, overtrainer? All those things will key you into, oh, I'm probably going to look there first. So obviously with that one, it's a lot of lifestyle. I mean, all this is lifestyle, but there, it's like, we got to get the training down right away. We got to get the cardio down. Hey, what's going on in your lifestyle? Is this more emotional driven? Is this more physical? And so that is driving the hyperandrogenism in that case.
Absolutely. These are the typical clients that I always say less is more right now. You know what I mean? We need to
Uh-huh.
pull back to be able to launch you forward in the future. And another marker that I personally have seen, I haven't seen literature on this, but Jay, and I would love to know if you've seen this as well. I generally see in these clients dealing with adrenal based PCOS or adrenal driven PCOS, I see high reverse T3. Is that something that you notice as
Yes,
well? Okay,
100%.
so I see that, and that
That's a sign of stress.
automatically cues in a marker of stress. Absolutely.
Yeah. So for me, just so our audience has an idea, anything over 16 for me is I'm gonna say, yeah, stress is driving that here. Another one is SHBG. If you get that marker, if that's high or even over 100, there's stress going on. And so you can look at that one as well, and that's a good indicator too.
Awesome. Yeah. So the last one that we'll go through, the last type of PCOS is post-birth control
Birth
PCOS.
control.
And this is something that a lot of females have probably experienced, either
Mm,
temporarily coming off and
yeah.
just haven't realized, and not, they're wondering why they're not getting their cycle back. And they think it's just, this is a normality of, it's a lot of doctors. Even I've had clients come to me and say, my doctor said it was, normal for me to not have a period for a year after. You know what I mean? Well, usually 3 to 6 months, maybe, but you elaborate on this one, Jay.
Yeah. So Brandon hit the head. Technically it should be about 3 to 6 months when you just came off. If you came off a year ago, probably barking up the wrong tree, but maybe not. But 3 to 6 months is about what they educate you on to look at. So that would be the question you need to ask your client. And so what's happening is when you think of hormonal birth control, we know that it's trickling in just enough hormone to basically stop the ovulation, and therefore you can't get pregnant. So it's just a little bit. And so it's keeping those hormones down. And what happens over time is testosterone, we know from studies, starts to go down as well.
Mhm.
And so you basically have this like little cog in the wheel keeping everything from spinning. And when you remove this thing, that's when you can have an androgen shoot. Now, I'll be honest with you, what I see more is an estrogen shoot. So if someone wants to come off of birth control, I'm almost always cranking liver, detox, all that, throwing them on some estracort, some chasteberry, and bringing them off. And that's for a whole nother topic of bringing someone off birth control. But I do that because I see more estrogen surge. However, if someone was put on birth control because they had thinning hair or they had acne or all that. So you have to ask, well, then shit, you better be careful when they're coming off. So then I'm going to be proactive and probably put some saw palmetto in right away, some things that help with moving through those androgens and controlling that the DHT pathway.
Mm-hmm.
So, my point is ask them, why were you on birth control in the first place? And then that might help you decide if this is something you have to worry about if you're helping someone off of it. If they've already came off it and you're seeing androgenism, then you just treat it as PCOS and you start going down, and still you would add your saw palmetto and different things and fill in what birth control might have depleted their body of. But I hope that gives you a little, background on that one.
No, 100%. That really does explain it. But this is actually, this one especially, this is something I see on both sides of the equation. So sometimes I have females that have come to me and they've been put on birth control to control hyperandrogenism.
Correct.
So what we see in most of the literature on birth control, especially oral contraceptives, that are a mix of estradiol and progesterone or progestin, is that they cut down testosterone-free testosterone production by up to 50%. So now
Correct.
someone that has been, sometimes in a case, so for instance, average testosterone levels of a female would be between like 15 to 70 nanograms per deciliter. However, in a lot of PCOS cases, we're seeing between 100 to 200. So these females were at these elevated levels of, say, total testosterone, and now they've been cut down. But what ends up happening, like Jay is alluding to with the negative feedback loop, once they get off, it's essentially like they've had their hormone, production suppressed, and now they get this rebound and it reshoots up. And so now they have all of these same symptomology, and sometimes worse, honestly, after they get off birth control, because now, there's emotional effects, there's hormonal implications. Now they're getting acne, they're getting hair growth, all these other symptoms that they were unable to really, I guess, deal with lifestyle wise because they were put on a pharmaceutical intervention to kind of control it, but it was almost like a band-aid that wasn't a long-term solution. So that's really where we got to look at, we'll go through, especially, we'll start, going into the podcast about how do we treat this. So, to go down that pathway, I think one of the best and most effective ways to manage the symptoms and the health implications of PCOS is going to be nutrition wise. So there's multiple nutrition strategies that can help to induce weight loss, which in and of itself has been shown to alleviate a lot of the side effects of PCOS, as well as improve a lot of the symptoms that we've spoken about. So, especially like insulin resistance, which is so common in PCOS. So Jason, let's discuss some of the nutritional strategies we can use for the management of PCOS, because this is going to be a major key, as we both have hit on. This is a lifestyle syndrome or a lifestyle driven disease. So one of the main components that we need to use, especially as, from a functional nutrition perspective, is going to be what they're doing nutrition wise.
That's correct. So, this is where my mentor really helped me, Vince Pitstick, and I use his flush for sure. So that's it's like a 14-day period where I basically can get your calories from 1100 to 2100 without you gaining weight, and you usually lose. So now I've got you fed up for a minute and I've got all your inflammation down. So why do I want inflammation down? Well, if you have insulin sensitivity issues, it's not just a sugar issue. It's an inflammation issue. And so I want the inflammation down. And then once the inflammation's down, I can reset you with carbs. I just have to have you on a deficit. I don't have to be on a keto diet or anything like that. I could, but carbs and sugar aren't the full enemy. I get your inflammation down and then a little bit of a deficit to work through it. And I don't want a ton because there's probably other things going on and you've been, already probably lower cal. That's why I like to shoot them up high and then I can create a deficit from there. So that's kind of how I work the case. If people are wondering about the flush, it's very low protein, maybe 95 grams. I go pretty high in carbs, 270, a lot of times, maybe 65 to 80 fats, a lot of fruit juices, a lot of fruit, very low protein, a lot of fish, pull your caffeine out. It's just time to detox the body and get your calories up without you gaining weight. There's a lot more to it. And I don't know how in depth we want to go, but I'd start there. And then I work the case in terms of creating a slight deficit if we're dealing with insulin resistant PCOS. But again, you don't have to pull all carbs if you work on getting inflammation down too.
Absolutely.
I agree. I think that's a double-edged sword, man. I think too many people, and I think we've all been guilty of it. We'll be like, oh, I'll just do a keto days for them and stuff like that. And I'm like, context is everything. You and I both have talked about that. But when the PCOS cases, I find that lowering the deficit through more carbs, like you're speaking, and then cycling them up and down works really well for them in terms of managing it.
Yeah. And I might have some days, when they're not training where they're pretty low.
Yeah.
But I just know a lot of people might say, oh, I'm going to go right keto. And I don't do that. I'm just letting listeners know it's not necessary if you're controlling inflammation, first and foremost.
Absolutely. And even when we look at insulin resistance in and of itself, I did a presentation with both of you guys at the PEC in January, and I showed, calorie controlled studies, high carb, low fat versus low carb, high fat, and they have equivalent outcomes in terms of improving insulin sensitivity, even those with obesity, overweight, type 2 diabetes. But even when we look at systematic reviews on diet composition in the treatment of PCOS, we see that weight loss improves the presentation of PCOS regardless of the dietary composition. So they've looked at high carb versus low carb, and they have very equivalent outcomes as long as they're reducing calorie intake and they're driving weight loss or fat loss in and of itself, because with fat loss is going to come the decrease in inflammation, the increase in insulin sensitivity, and so many other effects. But Jay, when we look at like, say, like the diet model or like some of the nutritional components that you utilize, in terms of just like a background of what are some suggestions you would make beyond the flush once you get them past that phase where you've pulled down inflammation, you've reset their body. I always say a healthy body is a responsive body, so we've gotten them in a much better and healthier state to be more responsive. What are some aspects, and this is actually something we could do as a roundtable, some of the nutritional components that we've seen to work really well?
Yep. So I like to create a lot of diet variety for what my people come to me at. So, if they're eating a lot of chicken and beef and high protein, I'm going to still keep that turned on its ear, so the protein's going to go lower. I'm probably going to do a lot of fish. But I'm going to use a lot of fruit actually with someone that's insulin resistant. Fruit does really well, actually, if you're in a little bit of a deficit, to really help insulin resistance. You might think, well, that's kind of weird. It's fructose and et cetera, it's sugar. But I do a lot of fruit, a lot of veggies. They might get some starchy carbs around the workout. Off days, probably really not many starchy carbs, fruit, veggies, the fish, lots of healthy fats. Fish oil is really important with keeping the inflammation low. But you could also do it with extra virgin olive oil. These are anti-inflammatory fats. And if you remember, the first thing I did was I flushed and I got the inflammation down so we can work on the insulin resistance. So I'm going to use foods that do that as well. Fish is great at it. Fruits, phytosterols, veggies, nuts, good omega-3s to bring that down. So that's going to make up the bulk of my diet for these people. Now, I really can't throw out macros because everyone's going to be different. But like I did say, I might vary the carb intake. So they could have like 2 or 3 days where, that's a little higher and the protein's lower. And then maybe the 2 or 3 days where I bring the protein up and maybe the carbs dip under 100, but it's still all very, very healthy. And I'm not pulling to zero almost really ever at that point.
No, absolutely. No, and I agree with actually the implementation of fruits, especially because we actually see, and this is something I see in practice, but we also see in the literature that lower glycemic index diets work better for those with PCOS. So there's actually, a long history of research that looks at comparing low glycemic index diets versus traditional diets in females with PCOS. And even when they control calories, they put them in the same relative deficit, they see better improvements, not only in insulin sensitivity in those suffering with PCOS, but they also see greater improvements in menstrual regularity. They see greater reductions in all the indices of insulin resistance, but they also see better improvements in total cholesterol, HDL, and LDL, which is another factor that a lot of times, especially with inflammatory PCOS, we see their blood lipids are a mess. And this is something I've seen, on their blood work and stuff. So these are just different
adrenal
dietary
PCOS too, because
absolutely, high stress,
and they're liberating fatty acids at a high level, and so that's being picked up in the total and LDL and things like that too.
Absolutely. And then some of the other components of the diet that you had spoken about, this is very much of a Mediterranean style diet.
Yeah.
So we're having anti-inflammatory foods.
Yes.
It's very whole food based. So this is something, and I will, I do want to get to, I'm going to put you on the spot on this one, Jay, because I'll tell you how I approach a PCOS case. I give them a meal plan. And I'm telling them, obviously, I'm titrating things to them as a specific individual, but a lot of times I'm looking at nutrition and food as medicine. And I know you guys share my ideology with that, but I know you're known as the macro manipulator. So I want to know, do you just in this case, this is a functional case, in this case, do you give a client macros and let them be flexible, or are you giving very specific sets?
I build the flush diet and I build their first probably 2 or 3 sets of diets. Once they understand what we're doing, and if they ask for macros, I allow it. But no, I build, like I said, if I'm kind of doing like a higher carb and the lower carb, I build all of it. And it's food for food, because I want them to see what we're doing. And then they kind of get it. And they're like, hey, can I sub macadamia nut oil for olive oil? Of course. Can I sub pineapple for these strawberries? Sure. Can I eat, cod instead of salmon? Okay, but now I got to adjust your oils. All those things are fine, but I want them to see it first. So no, I take a little bit more control actually in my functional cases.
Now, you know what? I wanted to ask you that because there are times that, I get a complex case, and that's where it can't just be macros and it can't be just a food list that I send them. It needs to be
Yep.
very specific. And I explain that to clients sometimes, like, listen, with my regular clients that they're, in a good state, they're healthy, I'll give you a full food list. I'll put macros. I'll give you, generally I'll give them like a day of eating, like a suggested day of eating or a, example day of eating, but they're able to, swap as they prefer. However, with these more complex cases, with these functional cases, I build up the diet and I tell them, listen, initially I really need to gauge your response to this. And we're trying to go after something that's much more complicated than just, utilizing macro coaching, or it's not just the X's and O's of calories and macros. Now we're going into the polyphenolic compounds. We're looking at the micronutrient value. We're looking at the omega-3 fatty acid. We're looking at your, omega-3 to omega-6 ratio. We're looking at all these parameters because I'm trying to improve your blood work and I'm trying to improve the symptomology that you came to me with as soon as possible. As we get deeper into our time working together, I get to know you better, as well as you get better educated on what we're doing and what we're accomplishing. And you're seeing progress at a more expedited rate than if I gave you just macros and let you do it on your own. That's when we can take some of the, parameters off. We get more flexible in terms of our education, in terms of swapping and really manipulating things. But there is a set standard or a set structure when they come to me.
Yeah, we do it the exact same way, 100%.
Glad to
And
hear
I
that.
do that with pretty much all my functional cases, whether I'm dealing with weight loss resistance, amenorrhea, Hashis, all of it. I want them to get a true feel for just the way you broke it down. Like, what are these foods that we really need?
Absolutely. All right. So on to the next thing. This is definitely something I want to hit on because, oftentimes we see, the vast majority of those in that have PCOS. So if we look statistically, about 70% of those with PCOS are obese or overweight, and they're carrying excess adiposity. So this is only going to exacerbate a lot of the symptoms that they're dealing with. Their insulin resistance, their inflammatory markers. So can we just, hit on some of the benefits or, some of the strong points of losing weight and how it improves PCOS symptoms, because this is a major key for a lot of people when they come to me. This is like one of the main drivers, like you've alluded to, saying, listen, we got to get them in a deficit. I feed them up first, I build their metabolic capacity, but then I bring them back down to a deficit because that's going to be the most effective intervention at, solving some of these signs and symptoms.
Yeah. Yeah. So we know that by losing body fat and working on that area, that you're going to over time improve your insulin sensitivity. You're also probably going to build a little bit of muscle, even if I'm not pushing your diet crazy hard. I find with the insulin resistant ones, as that comes down, they're obviously going to shift more to being able to build muscle. Plus, a lot of these clients are new to the gym. So even though I don't train them at maybe at 7 RPE, they're going to build a little bit of muscle. That's going to make them more metabolically active. So as we're coming down and they're putting on muscle, all these processes are happening where the metabolic rate's coming up, thyroid's improving, and, we've got insulin sensitivity coming back and hormones regulating. And we can talk about, what I might do to bring progesterone in and all these different things. And it's all hitting because the body is a system, right? So all the systems are now starting to work together. And that's what you're trying to hit on. And that bringing that weight down is the first real catalyst, especially when you're dealing with the insulin resistant type PCOS.
Absolutely. And even if someone says, say we have someone that has adrenal PCOS, but they are overweight as well, we see benefits with as little as 5% weight loss. Like if we actually look at the studies on women with PCOS, we see that even just 5% weight loss has, benefits such as improving menstrual cycle function, improving fertility, which is a huge one. That is one of the leading issues that females with PCOS have, because think about it, they've lost menstrual cycle function. They have now hyperandrogenism. So they have, excess hormone production in terms of testosterone, free testosterone. But then, as you had mentioned previously, another thing I see is relative estrogen dominance. Because they haven't had a cycle, they're inovulatory. Now they have no progesterone spike, essentially. So they have very low progesterone, relatively high estrogen. They don't have the, essentially the systems in place or the hormones in place to, be fertile. And so we even see, what's really interesting is when you look at fertility treatments and you look at ovulation inducing fertility medications, they work better when someone has lost weight. And they also work better even when you look at gastric bypass. So when someone has one under gastric bypass that has had PCOS, they see better outcomes to fertility treatments. And, you know, obviously it has the over, you know, arching benefit of that improving insulin sensitivity, improving inflammatory markers. And also, as you actually said, this is something I sometimes see when it's not an athlete that's coming to me with PCOS. When it's a lifestyle client, we sometimes get a really nice recomp effect, and it's multifactorial. So yes, they're building some muscle, but I've pulled off a ton of inflammation on them. Like sometimes just within the first few weeks, I've run your flush on a small number of clients, and they're peeling out 5, 6, 7 pounds in those 2 weeks, and it's all inflammatory driven. So now they're more insulin sensitive. They're partitioning nutrients better. They're getting better pumps in the gym. So it's like, dude, we're hitting every system and we're improving things much more than your average coach would see.
Correct. 100%. I mean, you know, I always say, and this is not a knock on any coach out there, but these lifestyle diseases you're not going to solve with macros and training. Like, it's just not going to happen. You have to have an understanding of the physiology. You have to have an understanding when to push, when to pull, and then also what supplementation to bring in as well. It's all got to be there. And, you know, just pick the right coach.
Absolutely. You got to have someone educated and that's willing to, you know, really advance and push their education. That's one reason as I came to you for a mentorship, you know, regarding functional nutrition. And I'm always looking to dive in deeper. I know Jeff is very much on the same page with me in terms of that, always looking to be able to find another tool in the toolbox, because just that macro manipulation doesn't always work. That if that's your only tool and it's only about, you know, setting macros or you know, increasing or decreasing volume, you're going to find yourself in a rut where you can only help a very small subset of the population. Because most people, if we look at, you know, you guys know this because I did a presentation on this, but 92.6% of Americans today are metabolically unhealthy. So they hit the metabolic syndrome criteria. So a very small percentage of people are actually metabolically healthy. So the vast majority of lifestyle clients that we work with, and the majority of people that we interact with, especially going forward, especially as we get to 2030, where we're seeing escalating rates of insulin resistance, type 2 diabetes, and obesity, we're going to be, you know, essentially treating a sicker population. So we really got to level up our skills to be able to best serve them.
Yeah, I always say if you're not learning functional nutrition, you're going to be on the wrong side of the fence in about 2 or 3 years. You know, you can fight for bodybuilding clients, but, you know, the cream of the crop is going to rise there, and then the rest are going to starve. And you better be on the right side of the fence as this develops.
I'm with you, my man. So, you know, next topic, let's go into supplementation, because this is a big one. And you and I are supplement buffs. We've worked in the supplement industry for a long time. You have one of the few brands. So I've worked for many supplement companies over the years, but my clients can, you know, attest to this. You are one of about 3 or 4 brands that I recommend, and I send the links to you for them to purchase your products. And just so everyone out there knows, you know, Jason is a co-owner of a company called New Ethics, a phenomenal supplement company. Doesn't always carry all the stuff that we'll go into today, but you have a very large, you know, variety of stuff, especially stuff like Thyroid Boost and different functional products that can really help people with hormonal issues or that are suffering with some of these functional issues. So when it comes to PCOS, what are the most effective supplements that you utilize within your clients?
Well, let's break it down per category. So let's start with your insulin resistance. So we talked a lot about your nutrition, flushing, what it means, you know, how to look at the lab. We have a product called G-Day Max. It's going to help improve insulin sensitivity. So I'm going to use that with, you know, probably 4 carb meals a day with these people. And it's possible I do every meal, even if I have some protein veggies in there, just because their insulin sensitivity is so poor. It's certainly not going to drive their numbers so low that they're going to be hypo or anything like that. So that is a product that I would use. And again, it's a glucose disposal agent, improves insulin sensitivity. Now, let's talk about what's going on the hyperandrogenism side. I use saw palmetto. It's an 5-alpha reductase pathway inhibitor. And so that's going to allow to kind of pull back some of the DHT, move some of it to estrogen, and get it out of the body via the liver. So I use saw palmetto. I go pretty heavy, probably about 250 mgs 3 times a day. I use Now Foods. Seems to work pretty well. You know, there are more expensive ones. Metagenics has one. You know, a lot of the different companies have it. New Ethics
Life Extension has one.
Yep. And so I'm going to use that. With insulin sensitivity or, you know, insulin resistant PCOS, I also like myo-inositol. I'm going to use 3 to 4 grams a day. And that's going to
let me ask you, because this is one I'm huge on. A lot of people don't talk about this. The inositols. Do you just use myo, or do you use a combination of myo-inositol and D-chiro-inositol?
The combination's better, but sometimes that one's a good bit more expensive. So I just manage budget. But the second one is better when you've got the combo. What do you use?
So I always use the dual application, because that is really what the research is on. And
Yeah.
honestly, when it comes to PCOS management, this is what I consider to be the most effective, natural intervention for PCOS. Because when we look at inositol as a category, like as an ingredient, as a whole, it plays a huge role in insulin signaling and glucose utilization. And when we look at the research on it, this was something I almost came out with a product for a brand that I worked for years ago on this exact thing. And they just didn't think that there was enough people with PCOS. I was obviously seeing it in clients, but realized, you're a large supplement company and you're looking at pre-workouts and protein powder and just the commodity items. When I was coming to them for this, what they considered a niche, and I'm saying, listen, there's about 20% of females, up to 20% of females that could, deal with this. They didn't see it to be enough of a driver to come out with this product, especially because it's very expensive. However, when I looked into the research on this, we see that it improves glycemic control. It significantly lowers insulin levels, which is obviously going to increase insulin sensitivity, but also on the back end of that, that's going to lower the risk of hyperandrogenism, because now we're not going to have that oversecretion or that hyperinsulinemia driving the fecal cells to overproduce androgens. We also see in randomized control trials that myo-inositol and D-chiroinositol, when used in, I believe it's like a 40-to-1 ratio, that they improve fertility, they improve the symptoms, or even like amenorrhea in and of itself, and it also improves menstrual cycle regularity. So I've seen vast, research. I've seen a lot of effects even on my clients. So we see myo-inositol is more for the muscle. It's going to help like peripheral insulin sensitivity, but D-chiroinositol is really interacts with the ovaries. And so that is what
brand on that.
So I have used Life Extension. I've used multiple brands. There is a powder. I always forget the name of it. And it's really bland in terms of the actual marketing name. I'll look it up for you and send it to you later. But it is a great blend. But I'll be honest with you, there's a lot of companies that they only have myo-inositol by itself. It's still going to be good for muscle insulin sensitivity. We're going to see some, improvements in insulin sensitivity and glucose control. But really, you want that D-chiroinositol, because that has it really tunes in, or it kind of like interacts with the ovaries, and that's what's going to help with, actually they have studies on this. It shows significant reductions in free testosterone in those with PCOS. And so that's really where we're getting more of the hormonal modulation effects. And we have not only randomized control trials, but there's actually meta-analysis that have looked at this combo of myo-inositol and D-chiroinositol. So that is what I consider to be the best thing. Another thing I'm huge with, especially we're talking about insulin resistance, is berberine. Obviously metformin is usually one of the first interventions that physicians will utilize, which is very effective. But some people, and I'm sure you guys have seen this, and I've gotten it myself, where you get a little bit of GI distress, especially in the initiation of utilizing metformin. So berberine is pretty much its natural alternative. So it has clinical efficacy to be very comparative to metformin. And even those that have I have seen very rare cases where someone has GI issues with using berberine, and that's where I actually utilize another extract of berberine. I'm not sure, Jason, have you heard of dihydroberberine?
I have, but it's not in GDA Max, so I stick with that. But I have heard of it.
Yeah, so that it just has a better absorption rate. You can use a much lower dose and less likely to cause any GI effects for that rare population that does get GI effects from berberine, because it does have antibacterial effects from it.
I guess the other final supplements I use here, usually chasteberry, because progesterone is low. And then a lot of times there's relative estrogen dominance, which we kind of touched on before. So I may bring in some estracort or some DIM to help with that as well. The chasteberry is going to bring up the progesterone, which we've touched on. That's usually fairly low in these cases, and fertility is that issue. So I hit them with that too. So I think for the insulin resistant PCOS, those are my main go-tos. Which one do you want to cover next?
Yeah, let's go to inflammatory PCOS, since it's pretty interlinked. So a lot of those supplements are still going to apply because insulin resistance is going to be a factor in this. But then when we get to inflammatory PCOS, there's specific supplementation we can do to drive down this inflammation.
So, let's remember with the inflammatory, we've already got an anti-inflammatory diet. We've already flushed. I keep our Metapure in from New Ethics, and that's going to help big time with inflammation. So it's going to be in my diets afterwards. I like to add extra curcumin in. I think I do like BCM 9.5 is what it's called.
Something that's the highest absorption extract.
It's a better, bioavailable. So I'll use that. I'm always gonna be running saw palmetto, because you're gonna have the hyperandrogen issue. And if money is not an issue, I keep the myo-inositol. You can do the D-chiro with it. I keep that in for all the extra benefits that Brandon was talking about. But with this one, if fasted insulin looks good, if, the other numbers look good, you might be able to drop the GDA max, just for supplementary budgeting. But here we're really trying to drive inflammation down. You should have fish oils already in the diet. That's going to help. Anti-inflammatory diet, curcumin, the Metapure. You're going to be pretty covered on the inflammatory side, especially if you're covering sleep and lifestyle factors.
Do you also, another thing that I utilize personally with clients is N-acetylcysteine. Do you utilize that as well? I know it's getting harder and harder.
It's in Metapure, so I don't use extra. But sure, it could definitely be a benefit.
Awesome. Yeah. So then any other supplements that you utilize within, PCOS clients? I know we've hit on a lot of them, things off the top of my head that I could think of. Generally, okay, absolutely. Let's go to that.
Side. So, again, the Dichiro, the Myo, that's going to help. Also the supplement is going to be there. Okay. But with adrenal, usually what you're dealing with is someone in like stage 1 or 2. So their cortisol is high. So in that case, I'm going to use our Cordes, which is a cortisol metabolizer. I might throw in extra ashwagandha with the Cordes. I probably will hit them with Cordes 2 caps, maybe every 5 hours, at least at first, and assess, when they finally say, hey, I'm feeling a little tired. Okay, well, we probably have the cortisol down. We can back off that. The ashwagandha is a great adaptogenic herb, which is just going to help you. It's not going to bring cortisol down. It's going to help you adapt to the stress around you. So we're going to try to coach you through it, but we're also going to put something in that's going to help you adapt to the stress that you have in your life. I like Sensoril because it causes a little more calm, whereas the KSFM 66 is nice, but it's not as much of a calming feel. Anywhere from 125 to 250 mgs, depending on how severe, will work with the Cordes. It's already got it in it, but I like to add more. We're going to use the supplemental. We're going to use the myoinositiles, the Dichiros. Let's see. Anything else? If that is, again, high cortisol, you might have someone who's actually bottomed out and they were already running high. And so that caused the hyperandrogenism, but now their adrenals are down. In that case, I use our Adrena Health and, I use vitamin C. Still resting them. I still use ashwagandha because ashwagandha does not push cortisol up or down. It helps you deal with your stress. And when their cortisol is already bottomed out, they're dealing with the stress even worse. So I use those to bring that back up as I rest and to get cortisol into a proper area as I'm bringing down the hyperandrogenism with the other products that we've already talked about that stay.
Awesome. Yeah, I think that pretty much wraps up all the supplementation. I know the only other things that I utilize, and these are pretty much staples, but they have some specific usage for those with PCOS, would be magnesium, which is going to really help with insulin sensitivity. We have vitamin D, which is obviously closely linked to insulin sensitivity and lowers the prevalence of type 2 diabetes. And then the last one would be if someone has post-birth control PCOS, I might use like B vitamins. Things that they've been depleted of, and those are just covering our bases. A lot of times when a client comes to us, they've just gotten off birth control and now they're kind of like looking at us to pick up the pieces.
Selenium, B vitamins,
zinc.
There's a few others that they are, but again, for me, those are all in Metapure. So if I'm keeping that in the diet, like you're getting a pretty good dose, but yeah, you want to replace those. And I alluded to that before and we forgot to come back to it. So I'm glad you went back around to that.
Absolutely. And probably the last one actually, and this is something I just recently stumbled upon. I had a client with PCOS maybe 3 or 4 months back. And I was looking into some more supplementation for her because she didn't want to go any medical intervention. So I was really using all natural interventions. And actually, and I know we're all a fan of this ingredient is carnitine. So we actually see females with PCOS, there's a small amount of research that shows that it's going to have, because they have higher levels of insulin, we know that insulin is needed to shuttle, carnitine into muscle to get it stored. So when they utilize, L-carnitine, especially from an injectable, source, it's going to get into muscle, and then carnitine plays a role in fatty acid oxidation, and it's also going to increase insulin sensitivity. So with those with PCOS, there's one study that shows improvements in insulin sensitivity and weight loss in a calorie controlled diet that was utilizing, it was actually oral L-carnitine tartrate, but that's just one other one that I would add in.
Yep. Yeah. And we offer a liposomal, so you get better absorption. And obviously injection's the best, but not many people, want to go that route. So we have a liposomal L-carn, and I agree with everything you said on that.
Want to chime in, Jay? We're about out of our time. We got one more question to go, but real quick, what are your thoughts on GLP-1s like semaglutide and the use of PCOS cases? Because being honest, I mean, it's, I mean, controlling blood sugar, you're seeing a lot of talk about that. Do you think that's maybe something not to pull the pin on? Or do you think that's something to just kind of like keep like in lock, kind of wait and see how things go? Cause I think there's a lot of other things first.
I'm a fan of semaglutide, but I only use it in the most intense weight loss resistant cases.
Sure. Okay, good. Thank you for clarifying.
Be managed 100% without that. And so it's never anything I've done. I've 100 see the application. I think if you have someone who is just the worst of worst genetically in terms of A1C and fasted insulin, if none of the lifestyle changes are working and diet, then maybe. But I really wouldn't see it, and semaglutide does lower inflammation too. But again, getting inflammation down is pretty easy if people, pull back on training, flush, do all the right proper things, good diet. So it's not something I really would advise. I probably would only advise it in the worst of worst, overweight, obese people that, the insulin sensitivity is just not improving.
Fair. Thank you for clarifying that. Last question. What are lifestyle changes to make with PCOS other than just change your whole life than what your doctor told you to do?
Well, I mean, the first and foremost is let's assess your stress factors, your relationships, your job, your sleep. We're going to do all that. Are you getting your water in? Are you, then we're going to change your diet. I think all those things play a big role. And I would probably go so far as to say, if you managed all those things and didn't take the supplements, you probably would end up in the same spot, just not as quick. So,
no, 100%.
Yeah. So it's the lifestyle factors that are huge in this, and it is a lifestyle disease. So.
No, that was a great way to wrap it up, because really when it comes down to it, as a coach, I'm a huge believer in focusing on what we can control as a coach and in our client's life. And really what that comes down to, besides nutrition, supplementation, and training, it really is lifestyle management. So we can help, we can control, or we can modify and modulate a client's exercise, their movement, their sleep, their stress management, and their habits and behaviors. And that really, it's an all-encompassing approach to coaching. So this is really why, I put this in the title. This is about functional nutrition approach, or a functional lifestyle approach to the management of PCOS, because this is all encompassing. This isn't just macros. This isn't just sets and reps in the gym. It is an all encompassing approach that all three of us as coaches have to take with a client. And it's more than macros. It goes so much more than just these numbers on a spreadsheet, It really is modifying and improving someone's habits, behaviors around nutrition, sleep, stress management, even their psychology. Because I even see with clients that have gotten the diagnosis of PCOS, some that have been misdiagnosed, that they almost have like a self-limiting belief on themselves about being able to improve their body composition, or they have these self-limiting beliefs thinking that they're always going to be obese, or they're always going to suffer with insulin resistance, or they're unable to lose weight because they haven't been able to in the past. And really, we got to flip everything. So it really is about taking incremental steps towards improving all aspects, because when one thing improves and you keep, with that domino effect, everything improves.
Yeah. I mean, the one thing I'll close it out on and tell people who are listening, if you are suffering from it and maybe you've not had great success, if you put in play the things that we're telling you, you will get it into quote unquote remission. I've found it's honestly one of the easier ones to get good labs, even within 10 to 12 weeks. It's not like dealing with Hashimoto's. That one will have you beating your head up against the wall sometimes. But PCOS, if you follow what we're saying here, you should get a really good outcome. And if you can't piece it all together, a good coach will get you an outcome on this and get it under control in a pretty, I don't want to say super fast way, but in a quick manner, as long as you follow what they're doing.
Absolutely. I couldn't agree more. Now, Jeff, you close us on out unless you have any other questions.
No, man, I think it was super good. I think between the three of us, it was peppered in along the way. You did a good job leading that one. Jay, thanks for taking the time to chat with us, man, and bring it on. I'd like to get you on and get Brandon, if you don't mind, to talk about the pitfalls of coming off birth control. I think would be a great episode to talk about because I think we all have our experiences, because I've experienced the Morena crash, which me and you chatted about, all sorts of things. And I think that maybe helping women get more psychologically prepared before they come off birth control would be a great asset for us to put out there together. But where can everybody find you at, show you love? Where can they sign up for your mentorships? All that stuff. You're about to go from Scooby Prep to Scooby U,
Health
right?
365.
Scooby Health 365.
Scooby Health 365 will encompass Scooby U and Scooby Prep and all those things. So it's just gonna be like an umbrella. it's time. It's more in line with what we do. But right now we're still ScoobyPrep.com. On Instagram, I'm ScoobyPrep1_IFBB Pro. If you just type in Jason Theobald, you'll find me too. It's in my bio. I think those are the main ways. I'll answer my DMs. You can email me, Jason@ScoobyPrep.com as well.
Awesome. Jason, thank you so much for coming on, my man.
Sure.
Always a pleasure, interacting, engaging, and talking with you. And thank you for delivering a ton of value on this podcast. We appreciate it.
Not a problem. I appreciate it, fellas.
Appreciate it, guys. All right. Well, thanks for tuning in, and everyone shows Jason some love. This podcast is great value. So thanks, guys. You'll have yourself a good one.
Peace.
Peace.